Welcome back. Finally, it's possible to reverse the painful damage of knee arthritis and chronic shoulder pain with real stem cell therapy. Joining us is Dr. Dan McDuff, Director of Regenerative Therapies at Integrity Stem Cell, to discuss this revolutionary treatment and explain what he means by real stem cell therapy. All right. You know, this is something that we were just saying right before we came on air that a lot of people think they know about or they've heard some things about. How would you describe real stem cell therapy?
Well, at Integrity Stem Cell, we're going to use the patient's own bone marrow-derived stem cells whenever possible. Whether you're 8 or 88, you have live stem cells in your body, and they're programmed to turn into new muscle, tendon, ligament, cartilage, and bone. Unfortunately, there are clinics who are cutting corners using amniotic or placental-based donor cells that are highly manipulated. They're frozen, and by the time they get to the practitioner, a lot of those cells don't survive. So even an independent laboratory here in Broomfield, Colorado, took samples from 6 different suppliers of these cells, and they found that most of them were 95% or more devoid of live cells. So by using only your own bone marrow cells, that's why we're saying it's real stem cell therapy.
Makes sense, absolutely. So who should be looking into some of this, and when should they consider it?
Okay, so stem cell therapy, what we know about it, okay, with the latest evidence is that we can repair musculoskeletal conditions, joint, muscle, tendon, ligament. So if you have chronic knee pain, if you have chronic tendon pain, those are the things that you might pursue this type of therapy. Also, if you've already tried other things like corticosteroid injections or other types of injections like Orthovisc, Synvisc, and they didn't have lasting effects, maybe it's time to get a free one-on-one consultation and seriously look at this.
And that pain can go on forever for a lot of people, that type of pain, absolutely. Well, let's listen to one recent patient who is very happy.
You know, I've had knee pain for at least 10 years.
Now that we're nearly at 8 weeks post-procedure, what changes would you say you notice most, and what things in your life have changed for you?
I really believe that going down the stairs has improved. That was pretty painful before, and that has definitely improved. I love to play golf, and I started back a couple of weeks ago. The ladies that I play with have really noticed a difference. They pointed it out, saying, you know, it's amazing to see me out there playing and no pain.
Improvement of quality of life is always so important for people.
Absolutely.
Talk about actually some of the misconception or even the skepticism that a lot of people have when they hear stem cell therapy because of some of the issues that you just mentioned.
Yes. So this is a lot of reason why I wanted to come on today, because a lot of hard sell marketing seminars and clinics who are cutting corners are already creating a stigma about stem cell therapy that it's just overpriced snake oil. Some of them are also claiming that they can treat diseases like Parkinson's, lupus, COPD, and heart disease, which they can't. There's no clinical evidence for that. The FDA's guidelines are that you use stem cells to repair muscle, tendon, ligament, cartilage, and bone.
So that makes sense. And that's the actual real stem cell therapy versus the other things that you were talking about. Is that correct?
Correct.
Okay. So when you talk about these FDA recommendations, it's imperative then that people know the difference? Like when they come into your office, what's the first thing you tell them?
Well, I explain to them that basically the FDA doesn't put their stamp of approval or disapproval on a medical technique, but they do have their latest regulatory guidelines for safe practices to protect the public. And they want to see that 2 main criteria are met. 1, that the cells are minimally manipulated, and 2, that is for homologous use. So I'll break that down. Minimal manipulation means we're not using chemicals or other enzymes to alter the shape of the cell when it's transplanted back into the body. And homologous use means like for like, that the cells that were transplanted to an area are programmed to turn into the same type of tissue. So bone marrow cells can turn into new muscle, tendon, ligament, cartilage, bone. That's what we're going to treat. Fetal and amniotic cells, yeah, they can turn into anything. They can turn into new heart, lung, liver, brain tissue, right? But do you need those things in your knee?
Yeah.
No, right?
Right.
You need muscle, tendon, ligament, cartilage, bone. That's what goes there.
Totally understandable. When you put it like that, it does seem like something people should be able to understand pretty readily. Now, when it comes to, let's say we've got all that done, you're doing this, is there a recovery period, or is there, how long can you maybe see some changes?
Well, that's the beauty of this type of therapy, Gina, because there really is no recovery time or no downtime, as I tell people. There's 2 to 3 days of discomfort after the injection, and the bone marrow aspiration site, people never really complain complain about that. But then it's take it easy time, as I like to tell people. So as we're heading into ski season, what I really want people, this is a great analogy. You're not skiing for 4 or 5 weeks. Then you're going to hit the groomers, take it easy, don't fall down. Okay, but then people are pretty well back to full activity within 8 to 13 weeks, and we're going to guide you through a physical therapy program to make sure we do it right and get the most out of this.
This sounds wonderful. Thank you so much. Call today, 303-515-1642 for your one-on-one consultation, which is absolutely free. And to celebrate Integrity Stem Cells' new location in Centennial, you will receive $750 off a stem cell treatment. Schedule your free consultation to learn all about the therapy benefits at Integrity Stem Cell. The number again is 303-515-1642, or visit integritystemcell.com. They paid for today's segment.